Exactly. But now, moving on, the Ministry of Health, in collaboration with stakeholders such as Action Aid International, the Gambia, the Vaccine Alliance, ICARE, Swedish Postcode Foundation, Afyognik Foundation, and Shifo Foundation, is currently implementing a novel hybrid digital solution that collects, shares, stores, and distributes data for the expanded program for immunization, EPI, using smart paper technology. Now, the data is digitized and stored in an electronic register from which HMIS reports are generated and shared at health facilities, regional and national level. For more on that development, let's bring in Health Innovation Officer, and we have here Yorro Cham to talk to us about that. Welcome to Good Morning Gambia.
Thank you very much. It's nice to be here.
Right. So tell us, how did the idea of the novel hybrid digital solution come about, and why is this project initiative crucial towards the more sustainable archiving?
So the idea actually came about with the passion to help developing countries to join the developed countries in digitizing health records. And one of the key challenges to that in developing countries has been having to make it sustainable, because governments cannot sustain solutions that are brought to digitize infrastructure in Africa, because it takes a lot of resources with buying electronic gadgets, internet connectivity, electricity supply, and all those things are challenges to most developing countries in Africa.
What I'm actually really worried about is, with regards to our health system, is to diagnose you. When someone is ill, when you go to the clinic, for them to diagnose you is quite a challenge, because they don't know the history of your health background. Now, with this new system actually coming into place, how will this help doctors with their work?
Yeah, so how this is helping, this is actually just focused on immunization for now. We are working with the Ministry of Health and the partners that she mentioned, Shifo Foundation and Afyognik and all the other donors, to expand the solution into the domains of outpatient departments, nutrition and disease surveillance. And but just to answer your question, this solution is currently helping health workers at facility level to be able to service clients that come to receive vaccines at facilities. And through this, what this allows the health workers to do is they have the history of all the vaccines that the children had received. In the past, about 4 or 5 years ago, if a child was born in Bundung, for instance, and received immunization services in Bundung, and then the mother happened to travel to Basse, right, and then wants the child to be vaccinated in Basse, the health worker in Basse does not have any data, right, to know what vaccines this child used, and whatever vaccine the health worker gave in Basse would not also be up to date in Bundung. Right. So, but with smart paper technology now, what's happening is even if a child moves from one region to another region to receive services, all the data is harmonized, and health workers can access it across the board.
So it's all under one cloud system.
Yes.
Yeah. So how many health facilities are currently actually benefiting from this project, and do you plan to expand the initiative across the whole country?
Yes. So it's currently expanded nationally. We started as a pilot in one facility in Serakunda Minor Health Center. Most people know it as the Sandika. We started in May of 2017, and by January of 2021 last year, we expanded to all public, private, community facilities in the Gambia that offer immunization services. And currently the number is at 89.
Interesting. And so, I mean, this being the first country, the Gambia, in Africa to actually, adopt the SPT solutions, what does that mean for the advancement of our health sector?
Yeah, so that has actually put the Gambia on the map. The Gambia has been one of the best performing countries when it comes to providing immunization services in Africa for the past 3-4 decades. And taking the lead to be the first country in Africa to have an electronic immunization registry database at a national level is actually just a step further in cementing that legacy. And the idea is now to move on to other domains and then bring them on board as well. Like I said, with treatment, with OPD, outpatient departments, nutrition, disease surveillance, and also other domains within the health service delivery system that can benefit from such a solution, because it has been proven to be very sustainable. Right, within the government budgets.
I was going to ask, yes, because what we see happening is when we have new innovations, especially when it has to do with technology, how sure are we that we're able to embrace, these new changes and are able to accommodate them based on our budget and the systems we have in place. So far, I'm sure you've done maybe your study and your analysis to better understand how this can be more beneficial in future. What is your take on that?
Yeah, so as part of the information for the project to expand nationally or to roll out, during its lifespan, assessments were done at every stage. So when we began in 2017, we did an assessment in Serakunda, and then we expanded to cover 19 facilities. We did a second assessment, which was meant to inform decision whether to scale nationally or not. And during that assessment, it was then realized that with smart paper technology, the cost difference, the cost benefit analysis that was done, the difference was just $3,000 on a national scale. With the old system, the old manual system where a lot of data was lost, and all of those other challenges with the new solution. So $3,000 is adequate enough for government to sustain any solution. And the beauty about using smart paper technology is that at facility level, the reason why it is so cheap to operationalize and to maintain is at facility level. We are not using any electronic devices. Yeah. So they're using, like the word goes, smart paper technology.
What kind of paper is this?
I was about to ask.
What
kind of paper is this?
So the innovation there, that's where the innovation actually comes in. Because what we did was model the pre-existing registers that they had. If you go to any public health facility in this country, you find health workers writing in big registers, in big books. So what we did was to transfer the information contained in those registers into A4 size papers. Right? So when it is transferred into A4 size papers, health workers write on those A4 size papers, and then these A4 size papers are scanned. Right? So once they are scanned, then the digital component of the solution kicks in. Because what we have done is to have a software that recognizes the handwriting of the person and transcribes it for you. Right? And that's how digitization takes place. And the way we also forfeited that at facility level is to ensure that we still maintained the same routes that were there in the past, where health workers come to the regional offices to requisite for supplies, to have engagements with the regional teams. So what they do is when they fill in these forms, they submit them to the regional team, where they are scanned and verified, and then the data is digitized.
And you're sure that the health sector is very much willing to embrace this idea?
I mean, it has been embraced because we started in 2017. And we are actually in the 5th year of the project going on. And the idea is that by January 2023, we will bring on board the other domains, because immunization was just the gateway to try to understand whether this was going to be feasible and all of that. Now we've established that. And because of the work that we've done in Gambia, we are currently also working in other countries across the world. We are currently in 7 other countries across the world. But everything...
When you say we, who do you mean?
I mean the organization Shifo Foundation. We are currently implementing smart paper technology in Uganda, which is poised to be the 2nd country in Africa to have it on a national scale.
Very good. And so going forward, what's the next step in this endeavor now?
Yeah, so the next step is obviously to do an evaluation by the 3rd quarter of this year, which we are currently in, moving forward to December. And this evaluation is going to inform whether we also adequately expand into the other domains, and also inform on the performances of the current project, and then we make changes or other iterations as we proceed.
Expanding to the other domains will need a lot of expansion, I believe. Yes, because of the outpatients, maybe they see more, you may see way more outpatients than the babies. So I think that will be a great step to actually achieve.
Absolutely. So that's why we are working with the Ministry of Health, basically to identify those key areas that need digitization to happen. The reason why we are concerned about bringing on board the outpatient department is that way we are able to connect mother to child, to sisters, to brothers, because we already started with the babies. So now we have in the database up to 380,000 children that are under 5.
This could even help the national records, I mean, once expanded.
So it also will serve as a basis for the upcoming national health insurance scheme that the ministry is proposing.
Certainly.
Yeah, and then there's also another thing called the civil registrations and vital statistics, which the government wants to implement in the country to bring on board every person within the country to have a digital register.
Great innovation there. Yeah. Thank you so much for coming through, and we're looking forward to what will come out of this.
Thank you. It's a pleasure to be here.
Very well. That was Yorro, the innovation officer, talking to us about the latest development with that smart paper technology. Interesting to say. Yes, it's my first time hearing something like this, so I am super eager to see how this rolls out. But we'll take a very quick break and right by. And when we come back, we have a lot more in store to stay.